So today, basically, I will be delivering one small seminar, a brief seminar on Doctor of Physiotherapy and Doctor of Occupational Therapy from US. A very, very prestigious program, highly in demand, great career ahead, great earning opportunities as compared to India, huge scope, acceptance across the globe. So, and as well as I will be giving a brief information about the other USA Masters PG programs, which a physiotherapy and occupational therapy students can surely pursue in US, um, uh, related to the medical field. In fact, I will be giving a very, very important information that a physiotherapy student can also practice allopathy in US. So that program, I will be covering that program in this seminar. So after the completion of the seminar, then we can have a brief question and answer session where I will try to answer your queries. So basically, I am having more than 22 years of experience in the field of career counseling. Um, I'm an art of living faculty also conducting lot of stress management workshops. I have conducted. I was involved with lot of. I'm involved with lot of social initiatives, river rejuvenation projects, skill development programs, corporate training programs also. Uh, so we are a career counseling academy, and we are guiding the students right from 9 to PhD for all the streams. Uh, so basically, just a minute. Okay. So basically, our fundamental is that the quality education and successful career is the fundamental right of every student, and that's why we are putting our very, very dedicated effort for the welfare of the student, for providing right guidance. We don't represent any university. We don't take commission from any universities. We are the only one in India who are sending the students for the physician associate program, that is a second medical PG program available in US through non-USMLE routes. We are sending students to the residency program also. So I will request everybody to rename themselves, because a lot of people have not written their complete name. So your complete name, if it is mentioned there on your window, it will be very, very convenient for us. So my gentle request to all to please rename yourself. Those who have mentioned just their mobile phones and all that. So please write your complete name so that we can have an idea of who has joined the program. And that will be better for the interaction. So basically, irrespective of your academic credentials or financial credentials, we firmly believe that every student is should have a right for a, quality education and affordable education, and we are guiding the students in that direction. So basically, we have received lot of awards for our contribution in the field of education, around 45 national and international awards. So our founder director is Dr. Tushar Devras. He is an ex-scientist, Baba Atomic Research Center, and basically mostly is based in Chicago. And we have also our Indian offices are there in the Mumbai, Pune, Nagpur, Jabalpur, Vadodara, all these regions, Jabalpur. So we have different in Kolhapur also we have our office. So we are also providing online counseling services across the globe. So we have our major office in the Chicago. We are Academy of Academicians. We have received lot of awards for our contribution. Champions of Change Award was given to us at the hands of our then Vice President of India, Shri Venkaiah Naidu ji. This was a very, very prestigious award, since it was selected by the Supreme Court ex-retired Chief Justice Shri Balkrishnan ji. and basically it was a Niti Aayog award. So basically, uh, uh, just a minute, some technical snag is there. So I will again. We have also received Pride of the Nation Award at the hands of Rajnath Singh ji, our Honorable Defense Minister of India. Award was given to us on the very auspicious day of Vijay Divas. Very prestigious award. We have also received Maharashtra Gaurav Award at the hands of Nitin Gadkari ji, our Honorable Central Minister. We have also received CSR, Corporate Social Responsibility Journal Excellence Award at the hands of then Chief Minister of Maharashtra, Shri Devendra Fadnavis ji. Currently, he is a Deputy CM. Uttar Maharashtra Ratna Puraskar is one of the major awards we have received alongside Bharat Ratna, Swargiya Lata Mangeshkar ji. Award was given to us in 2017. Alongside Lata Mangeshkar ji and first Mahila President of India, Shri Pratibha Patil. So very prestigious. We have also received a very prestigious award at the UK Parliament, international award at UK Parliament. It was a very great occasion for us. Uh, UK Parliament receiving the acknowledgement for our efforts. It is a great thing, great source of inspiration actually. I have also received the Mayor Innovation Award 2019. I have received International Iconic Award at Russia, Moscow in 2019, 29th of June. It was a great award. Similarly, I have received Best Career Counselor of Maharashtra Award and at the hands of Imminent Research Foundation. So more than 45 awards. So all this awards gives us the inspiration to work in more positive way, in a more dedicated way for the welfare of the students. Basically, in today's agenda, I will be sharing all the information about. I'm just giving the brief profile about us. Then I will be covering the avenues, basic USA basic admission guidelines, scholarship guidelines, fundings, Doctor of Occupational Therapy, Doctor of Physical Therapy, and prerequisites for the admission. I will be covering all these criteria today. So basically, we actually analyze for all the streams, right? From humanities, from commerce. We are sending the student for chartered accountancy in the US. We are sending the students for the law programs in US and across the globe. We are sending students for pre-education in Germany, Italy, for various streams. So we are an academy of academicians, and Dr. Donald C. Martin, who is the ex-dean of Columbia University, is our director at the US, heading our US operations, and he is the ex-dean of Columbia, the fourth ranked university in the world. So very experienced person, very experienced team is available with us to guide the students. A lot of changes are happening in the complete education system across the globe, and technology is changing very fast. So analyzing the further future changes and accordingly guiding the students for right career path, it is very important. By matching the profile of the student, it is very important. Non-biased, totally student-centric focus. That is our main focus. We are a totally student-centric academy. So why to do the post-graduation from USA? What are the reasons? Of course, it is the number one economy in the world. Now, Indian and US relations are on another level, a different level altogether. Secondly, lot of research in the medical, paramedical fields is going on in the US. In almost all the fields, in technical fields also. Wonderful university network. Language is not a barrier in US. And of course, huge professional opportunities, huge earning opportunities for the all the streams. Now, as far as this physiotherapy and occupational therapy programs are concerned. They are very, very prestigious program in US. In India, in the B category cities, at least in Mumbai, Pune, Bangalore, or Hyderabad like cities, or Delhi like Chandigarh like cities, lot of awareness is there amongst the urban population. As far as the rural population is concerned, or the B grade cities are concerned, earning is a big issue for the therapist. Not everybody is going to be in a government job. A lot of reservation systems are there, and physiotherapy and occupational therapy are given as a therapy. It is provided to the society on a social cause at a very, very economical rate to the society for the welfare of the society. Of course, it is a great initiative for the welfare of the old persons and all that, but still, as far as earning opportunities are concerned, it is very, very limited. And lot of new innovations are coming up. Lot of research and rehabilitation programs are going on the another level as far as the US and other developed countries are concerned. So it is always be the priority of the students to seek best of the knowledge in the globe available, so that you can provide better professional services to the society. You can earn better. You can, if you can earn in dollars, you can have some money with you, and then you can come back to India and have a proper setup in India. So it will take our country also on a different level, the treatment on a different level also. So it is always good to have a research-based exposure, quality exposure, to work with quality guides, to work in a great hospitals. It is always, it is on a different level. So it is not comparable, no comparison at all. So basically, Doctor of Physical Therapy, DPT, physiotherapy, physical therapy. So this is a typically 3 years program, or Doctor of Occupational Therapy is a totally 3 years program. So when you go to the US, so basically these programs should be accredited by the Commission on Accreditation in Physical Therapy Education. And as far as occupational therapy is concerned, it should be accredited by ACOTE, Accreditation Council of Occupational Therapy Education. So basically, uh, just give TOEFL. What are the prerequisites? So basically, every student after the completion of after 12th also, you can directly go to the US. Lot of students who have already completed physiotherapy, they are present here. But if your siblings are there or your next generation is there, so you can directly send them. A lot of 12 students may be desiring to pursue the physical therapy education or occupational therapy education from US. So after 12th, directly they can move to the US. So education will be at a different level. So after the completion of your occupational therapy or physiotherapy degrees in India, what are the criteria? So first of thing is that you should do the WS evaluation. So World Education Service. So what they do, actually in USA, there is always, if you will go after 12th there, so there will be a pre-medical or pre-physiotherapy, pre-occupational therapy, pre-dental, pre-physician associate programs. So basically that is an undergraduation level program where they give you exposure, clinical exposure and everything at the undergraduate level to you. So this is Doctor of Physiotherapy is a postgraduate program, and Doctor of OTD is a doctorate program in the US. Now, and it's a master's level program, doctor level program. To post graduation is a minimum qualification to practice in US. Post graduation is a minimum qualification to practice in US. To have a license to practice in US, you should be a postgraduate. You should have a doctoral level degree there in US. That is a mandatory thing. So basically, if some students are going after 12, they will be going to the pre-PA or pre-occupational therapy programs. After that, they will build up their profile and they will give the GRE, and after that, they will go to the either a DPT program or OTD program. If you are an Indian student who have already completed physiotherapy and occupational therapy in India, so first thing you should do is you should do your evaluation with the WES, World Education Service. So what they do, they convert your Indian marks into the US GPA, and then the level of your education as compared to the US level. So they will be comparing your education with it. If your if your profile is very bad, if your profile under graduation profile is bad, then you will have to do certain prerequisites. That prerequisites can be done from the India, like anatomy, physiology, then chemistry, biology related subject, microbiology, organic chemistry with laboratories and all that. So lot of statistics is there. All these prerequisites are there. So you will have to do these prerequisites, but it is not compulsory for all the student. It is totally based on your evaluation. So generally, if the student has decent scores, has decent clinical exposure, or his academic profile is good, then there is generally they are waived off from the prerequisites. So basically, it is all depending on the WES evaluation. So it is very important for you to do it. Then language proficiency is important. TOEFL or IELTS examination and GRE examination. So I always tell the student to give GRE. You should always apply 1 year in advance. If you really want to go to the programs, generally the September, August intake is a major intake for occupational therapy and physiotherapy programs. So you have to apply 1 year in advance. You should start applying. Then that will create a great opportunity for you for the scholarships and all that. I will speak about my further slides regarding that. So, Doctor of Occupational Therapy, the program should be accredited by the CAPTE, Commission on Accreditation and Physical Therapy Education, and Doctor of Occupational Therapy OTD, it should be accredited by the ACOTE, Accreditation Council of Occupational Therapy Education in request. So 3 years program, and after that you can follow with the residency program. Residency is and fellowship programs also. And if you are interested, you can go for the PhD programs also. So a lot of specializations are available for the in different. I will be speaking on that. But all this is a pathway. This is a basic pathway for you. Complete your degrees, build up your proper profile, and then give the standardized examinations, do your evaluation, and then you move there for the DPT or OTD programs. So basically, Doctor of Physiotherapy and Doctor of Occupational Therapy are a doctor level degree in physio and occupational therapy. It is an excellent option for students and professionals looking to upgrade their careers. It is really very excellent. The quality is in India and quality in US is at a different level. Totally new. My brother is there. He went there in 1994. My real cousin. So basically, and my bhabhi is also there. So basically, one of them is occupational therapy, and another she pursued her physiotherapy from India. And now they are having their own complete setup of hospital for the physiotherapy and occupation. Complete setup is there. They are having lot of assistant, occupational therapy assistant, physiotherapy assistant. They are earning on their knowledge is at different level. So it is a great opportunity for professionally, highly accepted across the globe. Totally research-based program. The program will take typically 3 years to complete your education. So you can apply immediately. You can apply immediately after your bachelor's degree. I will advise actually during your 4th year. It means if somebody is planning to apply for 2024 intake now. So the dates are already gone now. So 2024 uh, August intake, fall intake. So they should apply in the July 2023, August 2023. So if you are planning, so because January is a minor intake, major intake is in the August, and lot of scholarships options are also available for the student. It is based on the academic and non-academic profile of the student, basically. So how good is your profile? So it all depends on that. So early application is the key to the success. Timely application, building up during your undergraduation. I will be giving certain inputs regarding how to build up your academic and non-academic profile also. What are the parameters? So that is there. Admission for doctor level programs are highly competitive. It is very, very competitive program. Very less number of seats are available for the international students per program. So it is very, very important to work on your profile. Academic and non-academic profile cannot be built up in a day or within 2 or 3 months. It is a consistent effort. To build up your profile, it takes a consistent effort. And what activities you are doing. So in USA, academic profile, non-academic profile, and analytical ability. These three are the parameters which they consider the admission committee evaluates before giving the admission, because globally the applications are coming to the universities. So it is very, very important. The average salary package, median salary is $85,000 per annum. Around 60 lakh, 70 lakh rupees per year is the minimum salaries, starting salaries for the Doctor of Physiotherapy and Doctor of Occupational Therapy salary, approximate salaries are there. And depending on your seniorities and all that, you can go further, you can have further specialization, you can do fellowships, you can improve on your knowledge, you can do the residency part, you can have a specialization certificates from the associations. So your payment will be at a different level. So basically, what is the application process of the Doctor of DPT program and OTD program? So basically, there are two portals, PT CAS and OT CAS portal are there, where you can apply to the universities from the OT CAS for the occupational therapy and PT CAS for the physiotherapy programs. So shortlisting of university is the 80% effort. What is the profile of the student and matching the profile with the university and program requirement? It is very, very important. It is very, very important. So basically, you should take out the official transcripts from the university and do the WES evaluation of your transcripts. As I told earlier. So they will convert minimum 3 GPA during your undergraduation is the requirement by most of the universities. If your GPA is less, then certain prerequisites you will have to complete from India. You can do it. Now the wonderful thing is that with the faculty support, we can complete the prerequisites from India from US accredited universities with the faculty support in India. So we can do that. So if your academic profile is bad, in that case, the prerequisites are required. Otherwise, if you have an excellent if you have an excellent academic profile, then mostly prerequisites will not be required. References. Now you should have a 3 references. Letter of recommendations are plays a very, very important role as far as the admissions are concerned. It is very, very important document. So one should be with your HODs, head of the departments. One should be from the professional with whom you are working, or you have done certain, you have assisted certain professional physiotherapists. You have done the internship in some private hospitals at some clinical setups, physiotherapy or occupational therapy clinical setups. So you should take the professional also, one certification should be there. And two, from the faculties, it is very, very important. Now resume, you should create your YouTube 1122 minutes links for all your activities. Suppose you are you are seeing a cerebral palsy patient. So you should give what is your observation for that. If a guide is evaluating that patient and all that. So you are assisting the guide. So what you learn from it, it is very, very important. You should attend different level of conferences, multiple conferences during your undergraduation. And what you have learned from it, you should put a 1 to 2 minutes videos for it. You should create 2 minutes of videos for your clinical exposures, or your experimentation, for all your research. You should do some research also. Now this research can be on the environment, or can be on a non-academic subject, on a traffic solutions. You can conduct various spine awareness programs on the ergonomics and all that. You can create your own videos for the ergonomics and all that. It is very, very important for the learning disabilities, for the occupational therapy. What is learning disability? What is autism? So you have seen 10 patients, and what is your observation for that? So you should do this. A lot of data is available in your universities at the college level and all that. You should evaluate that data. You should prepare your YouTube. It is very, very crucial. Writing ki just, yeah, I'm this, and does not create an impression. World over applications are coming there. So how competitive you are, how good you are. So this is a era of videos. All over, if you are doing some plantation activity, if you are doing some Bharat Swachhata Abhiyan, if you are organize some blood donation camp, you have volunteered during Corona, you are doing polio eradication program, or doing some artificial limb center, you are working in artificial limb centers and all that. So prepare video for that. It is very, very crucial. What research? Every physiotherapist and occupational therapy have submitted some thesis during their undergraduation. So you should have a video for that. What exactly was the nature of work you have done? How you understood the subject? It will give you a great opportunity to go to the best of the universities. It will create a great opportunity for you to have the scholarships there. Essays, your writing skills are very, very important. Why you want to go for a DPT program? Statement of purpose, statement of motivation. Why you want to take further education? What is your source of motivation? Your writing skills. Some universities may take your interviews also, your interview skills. It is very, very important. Resume. How do you prepare your resume? It is very, very important. Minimum 50 hours of observation of occupational therapy practitioner, or work with a licensed occupational physiotherapist or occupational therapist. It is very, very important. It is mandatory. It is mandatory for all. GRE examination. Now this GRE examination is very, very important, because 25% of the evaluation admission committees do on the GRE part. 50% is for the academics. Academics will cover what is your academic performance, what research you have done, whether you have some publications, whether you have done some review articles, whether you have done certain projects. This will all come under the academic profile, not only your marks. The non-academic profile will cover your social initiatives, your environmental initiatives, projects, any achievements in sports, taking up your hobbies. If somebody is doing Kathak or Bharatnatyam, if somebody is playing football or representing cricket, so how consistent you are in that, how regular you are in that. So you have to create your complete profile for that. 25% evaluation is based on that also. So official transcript, WS evaluation, if required, doing the prerequisites, graduate record examination, good marks, about 310. Applicants must arrange 3 references to be submitted from the faculty. Somebody giving, who has just cleared the physiotherapy or occupational therapy, if he is working last 2 or 3 years, the importance of his LOR is not there, letter of recommendation is not there. If some faculty, 25 years faculty is writing something about you, it has an importance. So it is very, very important from whom you are taking the LOR, letter of recommendations. How you prepare your YouTube video creations. You should put a 1 minute links in the profile. My son Shubhankar went to the Washington St. Louis University for the LLM program. And during the COVID period, he joined one German arbitration online program. He worked with Shardul Amarchand Mangaldas, one big legal firm in India, online mode and all that. So for every activity, he prepared one YouTube link and he shared his experience regarding that. You will not believe he applied to around 15 universities, and out of that, in 14 universities, he received the scholarship offers. He got around $40,000 of 1 year scholarship in the US university, and the Washington St. Louis University, one of the best in the US. So those students who are into the second year or third year or first year of physiotherapy or occupational therapy, take it very seriously to build up your profile. Participate in the research, attend more number of conferences, do research publications, do projects, environmental social projects, join the Rotary Club. It is very, very important. Improve on your essay writing skills. So basically, OTD and DPT, the typically 3 to 4 years field work is mandatory and capstone project, which shows your specialization in the area of work. So that is mandatory for getting the admissions. So basically, every occupational therapist and physiotherapy will have to give the licensing examination in the US. Now, physiotherapist, after the completion of a Doctor of Physiotherapy program, DPT program, they will be giving the NPTE, National Physiotherapy Examination by FSDPT. It is conducted by the Federation of State Board of Physical Therapy. Every state has their own regulations for the licenses. So it is a combined examination. Federation of State Board of Physical Therapy examination, they will have to clear to be eligible for the licensing in US. And the occupational therapy will be giving the NB code, National Board of Certification in Occupational Therapy. It is very, very important. Basically, they have to give this examination. National Board of Certification in Occupational Therapy. So it is very, very important. So occupational therapy professionals who are certified with MB Code will have one of the following credentials. They will be registered OTRs, or they will be a COTA, generally certified occupational therapy assistant. This is generally the US students go for that. So just a minute. So occupational therapy professionals who are certified with NB Code will have one of the following credentials. They will be occupational therapy, registered occupational therapy, OTRs, and certified occupational therapy assistants. Just a minute. So these are the specializations. Means once you complete your DPT degrees, then you do certain residencies are preferred. Residencies, you can go for residency programs or fellowship programs. and you can have a certain APTA, American Physiotherapy Association, Physical Therapy Association, specialist certifications. So these are the 10 specializations available for the physiotherapist. You can go for a cardiovascular and pulmonary thing. You can go into the clinical electrophysiology or geriatrics, neurology, oncology, orthopedics, pediatrics, sports, women's health, and wound management. So these are the 10 specializations. You can go for this. But after DPT and doing certain fellowships or after residency, it is always, they have certain parameters. You should have a license, certain hours of experience, more than 2000 of hours of experience as a professional licensed physiotherapist or occupational therapist, then only you can go for these programs. Basically, so it is mostly this. These are very very prestigious, and this can improve your earnings also. So it is a non-restricted thing. Means after having the specialization in a particular thing, you can still work in all the other streams. All the means if you have an orthopedic specialization, you can go for pediatrics and all that. You can work. It is a non-restricted, but you are specialized on one area. That is the thing. For occupational therapists, AOTS specialized certification programs are available. Pediatrics, physical rehabilitation, mental health, first aid, low vision therapist, certified autism specialist, hand therapist, lymph edema therapist, sitting and mobility specialist, stroke rehabilitation specialist, neurodevelopmental specialist, geriatrics, brain injury specialist. All these programs are available. Now, basically, I will also share. So this is a NPTA, National Physiotherapy Examination NPTE results. So around 82% of the students, including the first time means international graduates, physiotherapy graduates, and American citizen. So around the 82% was the total ratio in 2022. 82% of the students passed the examination. Now, I will be giving certain brief information about physiotherapists, all the physiotherapists present here, students here, and occupational therapy students also, or professionals also. Okay, now there is, what are the different career opportunities for you in US? Other than your physiotherapy or occupational therapy, what you can do in US? So today I will be sharing very very important information. You can practice allopathy in US also. You can do clinical practices. You can do minor surgeries. You can do the surgeries. You can prescribe medication to the patients. Everything you can do. A lot of opportunities are there. So first I will give the brief information, that is Master in Public Health. It is a typically 2 years program. So basically, it is a non 70,000 is a basic salaries available for the Master of Public Health program. It will also require WS evaluation. Then you will be giving the GRE examination, TOEFL examination, and after that you can apply for the Master of Public Health programs. So basically, a lot of statistics is involved into that. You are making into the policy making regarding the health of the complete society in the crisis. How for polio eradication or for corona vaccination, all the policies are done by the Master of Public Health. So that is a great field. You can also enter into the Master in Hospital Management and Master in Hospital Administration. So MBA Healthcare Management, MBA Healthcare Management is another program. MBA Healthcare Management, Hospital Management, Hospital Administration. So these are fantastic opportunities for you. You can also go for this program with great employment. Lot of our students are doing very great job in US after completion of these programs. So it is a just 2 years program, and it will also require GRE and TOEFL examination. Now this is very very important program, and that is Master of Physician Associate medical PG program in USA. Medical PG is a minimum qualification to practice medicine in US. So if you will visit www.aapa.org, you will get a complete information about this project, about this degree. So Master of Physician Associate is a medical PG program. One is through the non-USMLE route, and physiotherapy students can also, or occupational therapy students can also, or paramedical students can perceive this degree from the master's degree from the US. So this profession was established in USA in 1967. Today it is around 1,68,300 PAs are working in US with more than 500 million patient interactions per year. PAs have. So PAs are doing all the basically all the medical care. 70% of the medical care is handled by the PAs in US hospital sector. They are doing all the preliminary diagnosis. They are giving the treatment, line of treatment to the patient. They are giving the complete counseling. In almost all the specializations, the PAs are working there, and they have license to practice medicine in US. So, Master of Physician Associate. Previously, it was called as Physician Assistant. Now, they have redefined it as a Physician Associate program. Very, very prestigious program. Around 303 PA programs are there in US, with more than 2,000 hours of clinical exposure. It is a master's degree. Around 175 universities you can apply for this program. So most of the PAs generally work, 50.9% of the PAs work in the outpatient department, 37.5 in the hospitals, 5.9 in the urgent care centers, 13.33 in other specialization, 28.05 in the surgical subspecialties, 19.83 in the primary care, 13.33 in internal medicine subspecialties. So basically emergency medicine, pediatrics subspecialties, all these specializations are available. So it is a 2 to 3 years of master's program. And after the completion of the program, you will be giving PANSE examination. And after PANSE examination, you will be getting the license to practice in US as a physician associate. Basically, the prerequisites are compulsory. Means when you are in your physiotherapy or occupational therapy in India, or if you have completed, so you will have to do the WS evaluation, and based on your WS evaluation, you will have to compulsorily complete the prerequisites are required with minimum 3.5 GPA. So basically, it is the second topmost job as far as the US News and World Report. It is the second topmost healthcare job available in US. DPT and OTD are at the third and fourth number there available in US. But best healthcare job is second most topmost priority is the physician associate program in USA. Fantastic. So you can surely go for that average salaries. If occupational therapists and physiotherapists are earning median salary of $85,000 per annum, they are getting around 1 crore rupees per year salary. Physician starting salary, physician associates, they are getting $1,25,000 to $1,50,000 per year salary in the US starting salaries. So what prerequisites? So prerequisites with 250 to 2,000 hours of clinical profile is required. So these are the 9 subjects where the prerequisites are required: anatomy, physiology, biochemistry, microbiology, chemistry, organic chemistry, genetics, medical terminology, psychology, statistics, healthcare experience. So 3.5 GPA is the basic requirement. Now anatomy, already you had done anatomy, physiology during all these subjects are there. Even pharmacology was also there for you. But the level of subject is different. They will compare yourself with the pre-PA part in the US. And you will have to complete the according the prerequisite, according to requirement, anatomy 100 level, 200 level, 300 level anatomy is there. So according to their requirement, you will have to complete these prerequisites can be completed in India from US online from the US universities. So you will have to do the standardized examination along with the prerequisite GRE, TOEFL, Casper, PA-CAT. Casper is the test behavioral tendency of the applicants. how is your ethics, how is your moral, how you behave with your, how is your mannerism. They will test all this, Casper. And PA-CAT is the test of evidence-based assessment of academic preparedness. So all these are the standardized examinations. So the students during their second year, third year can start the prerequisites from now. They can complete around 32 credits are there. They can complete two credits and they can make up for this. So all the specializations like family medicine, internal medicine, pediatrics, cardiology, critical care, endocrinology, gastroenterology, hematology, oncology, infectious disease, nephrology, neurology, pulmonology, rheumatology, all specializations are available. Emergency medicine, pediatric emergency medicine, other specializations, obstetrics and gynecology, ophthalmology, psychiatry, radiology, pain management. You can go into the pain management also, dermat, genetics, allergy and immunology, cardiovascular, cardiothoracic, surgical subspecialties, bariatric surgery, colon and rectal surgery, general surgery, neurosurgery, oncology, orthopedic surgery, urology, transplant surgery. All these specializations are available. So both the BPHD students and OTS students, occupational therapy and physiotherapy special, they can go for this program. So what is the highlight of this program? The highlight of this program is a topmost among the top 3 professions in US, very high job opportunities, non-cap H1B visa and speedier green card processing, curriculum when you go for physiotherapy and occupational therapy as well as PA program, since you are into the same courses, so 3 years of curriculum place training is allowed to you. So you can do the student jobs for 20 hours in a week, and after that you can opt for an optional practical training of 3 years. So you can stay there for 3 more years and you can work in the professional atmosphere, and then you can try for the H1B. So the great highlight of the PA program is that it has the non-cap H1B and speedier green card processing. That is a highlight of the PA program. Salaries, it is very prestigious job. Salaries $1,25,000 to $1,50,000 per annum starting. Prerequisites can be completed in India online through accredited USA universities at a very, very affordable cost. Scholarships and education loan available for the students. Even for the DPT program or OTD programs, lot of scholarship options are there. You can take a lot of funding opportunities are there. Bank loans are also highly available for you. All the great opportunity. So physician associate program, here you can do a 1 year full-time prerequisites program in India, and then you can go in next year for the physician associate program. The average cost of program, generally the admissions start in January, March and August. For the physiotherapy and occupational therapy, your admissions will be, major admission intake will be in August. Minor intake is there in January. So for already the deadlines are there for the January intake, already it is gone. Some universities in November are available. So basically, totally in USA, academic profile is 50% weightage, non-academic profile is 25% weightage, and 25% weightage for your GRE score, TOEFL, IELTS, your presentation, SOP, interviews, your profile. It is a research, great advantage. It is required in US. So basically, you should prepare a complete profile covering your marks from 10th onwards, work done in the area of specialization, project and internships, a research paper published, seminar attended, reading books, everything you should do it. Already I have covered the non-academic part, all your social and environmental issue, your projects you should cover up, hobbies, cultural programs, all this will be into the non-academics. So it is very, very critical to have university selection. It is very critical. Not every student can go to the Columbia or Harvard and Yale University or Washington Central University. By matching your profile, we need to shortlist the university based on your financial priorities, based on your Territorial priorities and based on your chances of getting the admissions and scholarships. It is based on that. So basically, the average cost of DPT program and OTT program in US is starts from $20,000 to $40,000 is the average fees for the program per year. Lot of scholarships options are also available for the students depending on the profile. And physiotherapy PA programs cost is $30,000 to $50,000 per year. It is a 2 years program. So documentation is another most important thing. Based on that only we can penetrate best of the university admissions and we can achieve the scholarship goals also. Letter of recommendation and proper statement of purpose resume has lot of importance. So basically, scholarship is based on early application. How early you apply, whether you put your application for early review or not. If you have a very good profile, but if you are applying late, then there will be no chances of scholarship. Student can assist the teachers. Student can achieve teachers for different project. That is called a teaching assistantship. And based on their recommendation, lot of scholarships are there for the student. Research assistantship means during your DPT program or OTT program or PA program, you can do lot of research assistantship with the professors, and you can based on their recommendation, you can get lot of allowances, or you can your fees can be waived off. In-state and out-state fees category wise, in-state fees 50% less. So based on the certain documentation and requirement of the territorial requirements, we can prepare these documents. And it is always scholarships are given on the first come first basis and based on your profile. It is always there. Now F1 visas are easily available for the students. You can stay 3 years OPT means at least 5 attempts of H1B visas. OPT 3 years optional practical trainings to you earn while you are on F1 visa. You are doing the OPTs there. Optional practical trainings there on the H1 on the F1 visa. So you are earning there. So you can repay your all the bank loans during your OPTs. And if on the lucky draw system, you can go for a H1B visa through your hospitals there with whom you are working. As far as PA program is concerned, it is a non-capped H1B visa is there for the students. So it is always great to go up to a better system, to have knowledge, best of the knowledge, best of the research, and upgrade your knowledge and skills will surely benefit to the total society. And you can also earn at a different level. So these are our numbers 9370. You can take the screenshot for this. Our offices are there in Mumbai, Pune, Jabalpur, Nagpur. You can take the screenshot. Our websites are also there. We can have one-to-one online or offline counseling sessions. And based on that, we can advise you as per your requirements. So you can take the screenshot for this. And now we can have the question and answer session. I hope the information was, I tried my level best to share whatever knowledge I was having, information I was